Good afternoon, everyone. Uh, I'm Vikrant from Physiorevive, and we are back with a very simple and basic, interesting topic for everyone, which is when you should go for physiotherapy, and or you can say when do you need physiotherapy, or you can also put when do you need to see a physiotherapist. So uh, I'm gonna put light on all those common queries which a patient usually have regarding physiotherapy. Even for the common public who do not need a physiotherapy, at least they should know what exactly is physiotherapy and the scope of practice is. So if I talk about physiotherapy, it is a modern science which is advancing day by day. And if I'm not wrong, over a period of last few years, it has really evolved. So in every few years, we are getting new advancement which is coming in this field, and the scope of practice is really widening. So I can say that you can have a physiotherapy even for a 1 day old baby up to 80, 85, or maybe elderly people, they may also need physiotherapy. So what exactly is physiotherapy? Physiotherapy is a science, it's a branch of modern medical treatment which is based on physical means. So the treatment would be without medicine, not like any other allopathic treatment line. So a patient is treated, his or her condition is managed and improved without medicines through physical means. That includes exercise, that includes modification of activities of daily living, or through machines, or through manual therapy, which is being given by hand of a physiotherapist. So it's a very skillful profession where we are treating people's problem, or we improve their functions by using physical means. That's why it is called physiotherapy. So in common language, if I say when do you need physiotherapy? So as I said, this branch has really evolved over a period of time. Like 100 years back, it was just routinely done mostly for polio cases or some other issues related like that, or in World War I and World War II, when there were many casualties and people were amputated because of the injuries during the war. So it was only restricted to that only at that point of time. But now the field has really evolved. So if I'll explain it in a common terms, so there are 5-7 branches of this profession. One branch which deals with orthopedic issues, which is called musculoskeletal condition also, or orthopedic problems also, which is related with the joint problems or muscle problems. Then the second problem, which is very common, is the neurological issues like stroke. Brain stroke I'm talking about means half of the body is paralysis. So in that case, you need physiotherapy, or that branch is called neurophysiotherapy. So that includes all neurological disorders like Parkinson's, cerebral issues, conditions like motor and nerve MND, myasthenia gravis, all etc. conditions which involves your neural tissues, your brain or your nerves. Then there is one more branch which is called obstetrics and gynae, which is related with the woman's health, or with the pregnancy, or post-delivery or post-surgical conditions. So that is also one of the branch. Then comes one more branch which is chest physio, a chest condition, and the cardiac rehab, which involves bringing a patient back to normal after any cardio procedures like CABG, right, which we call it bypass surgery or stent surgeries, right. There also you need a specific rehab, and in certain conditions where the lung conditions are involved, whether it is COPD or other disorders, or in bronchial asthma also. Then comes one more field which is sports related. So any sports related injuries which a person can have can be treated by that field. And beside that, newer branches are coming up. Pediatric is also one of the branch where a physiotherapist handles the pediatric conditions, means the pediatric population. of the problems related with the kids, with infants. So this is how different pillars of different kind of physiotherapies are. So in general, if I'll come back to the point, when exactly do you need a physiotherapist, or when a physiotherapy is required? So I'll give you 5-7 basic signs or symptoms which you should look for. So first thing which I want to start with would be any sort of a pain related with your joint or with your muscle. Whether it is a chronic type, means it's an old chronic pain which is there since a long time, from few weeks to few months or few years, or whether it is a newer pain which has just developed recently after any sort of an injury, after any sort of a game, after any sort of a condition, or even when there is no cause and suddenly you've started experiencing some sort of a pain. So definitely in that condition you should look for a physiotherapist who will diagnose your condition exactly, and then accordingly they will deliver the treatment. Then the second sort of a symptom can be if you have a problem even while sitting on your desk. Means you have a job where you need to sit, and suddenly one fine day you've started experiencing sort of a pain, or even while sitting or while getting up, then definitely there must be some involvement of the back muscles or the disc, or some sort of an issue which needs to be catered on by a physio. Third sign or symptom I must say is when you have difficulty in doing your routine work. For example, you have a routine work where you need to do certain activities. For example, you need to do standing, or you need to climb up 1 or 2 story of stairs, and if you have started experiencing some problem in doing that, you should definitely look for a physio. Then comes one more condition where you have difficulty in doing your routine things. For example, if you started experiencing that you are now not able to bend forward too much as you used to do earlier, for example while tying your laces or doing your other activities, then definitely it's the time when you should look for a physiotherapist. Then there is one more condition or sign or symptoms which I will definitely stress upon is if you started feeling or experiencing some sort of a loss of balance. So that can be sometimes related with your internal ear, which is basically BPPV, or something related like dizziness or symptoms like vertigo. It is related with your internal ear issues. So there you need a vestibular rehab in physiotherapy. That is one part of difficulty in balancing and doing your work. The other part can be related with your higher centers, with your brain. So in that case also you should definitely look for a therapist. Now beside all these conditions, there are conditions like if you have a difficulty in taking out your secretions, like you have a cough or congestion in the chest but you are unable to expectorate. So there a physiotherapist will help you. Or in a condition like bronchial asthma or a chronic lung condition or diseases, there a therapist should always look for the remedial treatments. Then comes other non-sign or symptom conditions. For example, if a lady is expecting a baby, like she is pregnant and she just recently came to know that she's pregnant, like in the first trimester, in 2 or 3 months of pregnancy, definitely they should look for a therapist to have non-problematic pregnancy period and to deliver smoothly. Then comes the condition like after the delivery. There also in that condition you need to look for a physiotherapy or physiotherapist. Then comes any kind of a surgical condition, whether it is related with the joint, whether it is related with some sort of your abdominal surgeries. Definitely there are certain conditions which can be prevented if you are going for a good physiotherapy sessions. So this is all about physiotherapy and different kind of conditions where you may need physiotherapist or physiotherapy. And the important part is if you are consulting somebody's good, what they're gonna do, they're gonna basically diagnose first. So the first thing for which you should look for will be what exactly are you suffering from. So if you are going and visiting a physiotherapist, this is your right to ask, and it's the duty of a therapist to explain you in detail or in your own language what you are suffering from. So they may do certain sort of a test, certain kind of a diagnostic test. For example, they may move your leg, they will check through, certain things, and ultimately the whole idea or the whole aim of doing all that particular activity is to come to a conclusion that what a person is suffering from. So diagnosis, the important part. Once the diagnosis is made, then a therapist will explain you different aspects or different kind of treatment if there are different options which are available, whether you need just an exercise therapy, whether you need an electrotherapy treatment, or whether you need just a preventive care or lifestyle management, if that can help, or the counseling sessions during the treatment part. So everything will be explained by the therapist. So it's very important to have a diagnosis, then comes the treatment part. Many times I've seen people just go to straight to a physiotherapist or a clinic, and they say that I have this and this problem and I need this treatment. So treatment part should be decided in consultation with the therapist. Ideally, it is the duty of a therapist to give options to the patient. This is what we do. So a patient is well aware about the condition, and then there will be a tentative time frame is being given to the patient that this is what we are expecting the recovery in this much of time. Whether it is on daily basis or on alternate basis, it depends on condition of the patient. So ultimately, if you're gonna ask, or if I'll explain you in nutshell, it depends patient to patient and condition to condition for how long a physiotherapy is required and what kind of physiotherapy is required. But the most important part is that one should not ignore, because if anything can be treated at the initial level, then the duration of the treatment, complexity of the treatment will be on the lower side, and you may be saving yourself from surgery or from complicated conditions if you are reaching a therapist early. So this is very important to not ignore these conditions which we've just discussed, whether it is loss of balance, whether it is a pain which is recent, whether it is a chronic pain which is there since a long time, whether you have a difficulty in doing your activities of daily living, the daily activities which you do comfortably but now you have problem, or whether the conditions like pregnancy or any kind of a joint surgery like knee replacement, hip replacement, definitely you need physiotherapy. And then it's a sort of a teamwork which we explain, like active participation of the patient during the treatment part is very important. So reaching for a good therapist, following the do's and don'ts according to the physiotherapist's recommendation, and good compliance. These are the things which will decide your course of recovery. So you'll have an early recovery, you'll be saving yourself from financial constraints by putting more into the treatment if you'll not look into at the earlier stages. So in a way, it's a win-win situation for the person, and one should always look for a professional help if the conditions which I just explained are there. So this is all about when you should need a physiotherapy or you need to see a physiotherapist. So I've tried to touch all those key points which are very commonly seen in your activities of daily living. But still, if anybody has any question, then definitely I'll look forward to answer your queries or your questions. So I'll be happy to give reply to your questions. Anyone has, please do write it. And in the meanwhile, I must advise you one thing. As far as physiotherapy is concerned, one should always go for a professional who is professionally qualified. So look for a therapist who has a specific registration or the license number from the council of the state, whether it is in your city or in your state. You should always look for the credential of the therapist. And definitely it's important to ask if you have any queries regarding. Okay, we've got a question from somebody. Okay, can it help in rehabilitation post chemotherapy, as I'm facing joint stiffness post chemotherapy? It's a very good question. Definitely it is required. So what happens in chemotherapy, it depends on which part of specific cancer treatment you were going through. Suppose if somebody had a cancer in the breast tissue or in the back or somewhere where the joints are affected, the range of motion is affected, definitely one needs a physiotherapy. As far as chemotherapy is concerned, what happens, the chemotherapy treatment requires, those are very strong treatments basically. So during the course of the treatment, patient loses muscle mass and the strength and the agility also. So it's very important to recuperate from that condition. So in that case, good quality of strength conditioning exercise program as prescribed by a good professional physiotherapist would be definitely required, and it is going to help the patient. So in my view, definitely one should look for it as far as the chemotherapy part is concerned. After or during any chemotherapy sessions, if you have an access to good physiotherapy, that one should definitely look for. So as somebody has asked about chemotherapy, it depends on, in most of the conditions, whether it is chemotherapy or any post-surgical conditions, one should look for it. So yeah, thank you for that question. Anybody has any other question, please do ask, so that we can put more light, because the idea of sharing our knowledge and skills on the platform like this is to share or put more light. If you have queries, definitely it can be resolved. Surely we'll try to do that through our question answer sessions, right? And as far as other conditions, as I said, neurological conditions are concerned, that requires a longer duration of physiotherapy. So in a nutshell, I will say that if two patients are suffering one condition, like if they are coming with, say for example, back pain, the chances are one may recover in different time frame, one may recover in a different time frame, because each patient is different, each condition is different, whether they are suffering with the same symptoms. So it's very important to understand, one has to have patience also, and you should ask all your questions from your therapist, from your physiotherapist. If you have any single query, please sort it out, because it is our duty to explain to the patient how we are going to get the recovery, how we are going to bring you back to your normal life, and it is your right to know. So it's very important to have a good rapport with your therapist, so that we should get the early recovery. Anybody has any other questions, so that we can just sort that out? Many times people ask about the tentative time frame, so that's why I mentioned it. Time frame means in how many sessions or in how much duration I'll be fine. So as I said, it depends on condition to condition, patient to patient, and one of the key aspect in that is how good is your compliance, how well are you following the instructions given by the therapist to you, how well are you doing exercises, how well are you following those do's and don'ts at home when you're going back from the therapy session. So it depends on all these factors. That is about all duration part. Then one other key part is, sometimes people do ask about can I do it through virtual sessions. So not in all the conditions it can be done virtually, but yes, it can be done virtually nowadays, especially in the era of COVID-19 times. So over a past 1 or 2 years, therapists have developed those skills also, so that something can be given through virtual sessions. So definitely you should look for a direct access if you can have, otherwise look for a virtual session also if possible. And my take home message for you people should be this, that don't ignore your conditions, don't ignore your problems, don't think that they will be automatically or they will be fine on its own. If anything is not getting better in 48 to 72 hours, if it is bothering you a lot, you should definitely look for a professional help. Whether it is pain, whether it is difficulty in doing your activities, it is always important to reach to a professional help as soon as possible. So with that, I'll be looking forward if anybody has any other question. Anyone? Let me just... Okay, will my first treatment longer than the rest? Yes, this is a very valid question, right? If you're going to a therapist first time, your first session holds very much importance, because in that session, the therapist is going to diagnose your condition. So they will examine you, they will do assessment, and that session is always lasts a little longer than your usual sessions, because that involves your assessment, examination and explanation of the course of the treatment. So it's very important, and one should definitely give ear to the therapist what they are explaining to. Okay, one more question somebody has asked: do you have rehabilitation facility at any of your center, as there are many cancer patients that need these services? Yes, we do have. I can tell you proudly that we have 2 centers in Delhi, which is, one is located in central Delhi, the other one is located in south of Delhi, which is at Vasant Kunj, and we are giving an exclusive care and physiotherapy, advanced physiotherapy for cancer patients, especially whether it is post chemo or post radiotherapy. And we are targeting patient centric approach, where patient is at center, means according to the need of the patient we modify the exercise plan or the treatment plan. And our tagline is therapy redefined, basically to get the results at the earliest. So we are using lots of evidence-based practices, where we are totally focused according to the need of the patient, according to most advanced and scientific approaches, so that patient recovers faster. But again, as I said, it's a teamwork. So patient has to play his or her role, and we have to play our role. Then only we can get the recovery. So it's very important. Okay. Anything else? Okay. Anyone else? Any other question? Okay. One more. Will surely share your details in the cancer support group of Max. Thanks. Thank you so much if you can share it, because we are doing with a targeted approach. Okay, one more question somebody has asked: how many times a week should I go for the physio for results? So again, it's the same question which many people ask. So it depends on your condition. No two people are same, as I said. No two people are same, no two conditions are same. Even whether you have a one shoulder problem, neck problem, knee problem, it depends on patient to patient, your age, your severity, your kind of problem, what kind of problem you have, at what level, right? Means whether it is in a very preliminary stage or in an advanced stage or in a chronic stage. So there are many factors which affects the recovery time. So, and utmost important part is the participation of the patient. If patient is not having a good compliance, is not following what is being told by the therapist, then it is going to take more time. So to get the best results, I would say, please participate in your treatment well. Try to listen to your therapist. Try to follow all those conditions, exercises, all do's and don'ts, and you will recover definitely faster. Okay, will my physiotherapy treatment hurt or be uncomfortable in any way? No, not at all. I can say this: 99.9% cases you will be better during the physiotherapy treatment or after the treatment. It is a painless procedures, right? Different approaches, different treatments, and our job is to remove or treat your pain, not to give you pain. So definitely you're not going to hurt, you're going to feel better during the session also or after the session also. So definitely you will not have pain. Okay. Any other question? Send a request to be in your live video. Okay. Can I refer myself or do I need a doctor's referral? Good question. You can come direct to a therapist. You don't need a referral. But in certain government institutions, like for reimbursement or in certain insurance cases, like if somebody was admitted in the hospital and then he or she needs physiotherapy, definitely they need a referral in that case. Or if somebody is getting the treatment cost reimbursed from the government agencies, if somebody is working in some office, government office, or in some setup where it is mandatory to have a prerequisition from or the referral from a physician or somebody, in that case only you need a referral. Otherwise you can go straight in our country. As far as India is concerned, you can go straight. It is there according to the law that we have an independent right to practice. Anybody can come and we can just straight away start treating them and correcting them as soon as possible. All right, how much time do physiotherapy appointments typically takes? Okay, it depends on different clinics, different centers, how they are doing. So I can tell you what kind of practice which we are doing. So it's very easy. If you want, I can just share the number. It's 01145532700. You can call on that number, book your appointment. It will be done instantly. Once it is done, you have to come on that specific time in order to avoid inconvenience to you and to other people, because we follow a certain rules where we are giving pre-assigned time to a patient for the assessment first and even while delivering the treatment. So one has to follow the time frame, and it can be done instantly. It's not going to take a long time. And we do take appointments on phone. We do take appointment. Even you can drop down. So if suppose in case you do not get time to take an appointment, you can come straight to the clinic. In that case, sometimes you have to wait for some time. Otherwise, the best way is to reach us through phone calls or through email or through WhatsApp, and we will try to help you as soon as possible by fixing your appointment at any of our centers, and then you can come and visit us. So this is all about appointments. I'll be looking forward for any other question if somebody has. Otherwise, I'll just wind it up. I think, okay. Okay, so in today's talk, again, I'm revising few things. First point, do not ignore if you have pain, whether it is in your joint, whether it is in your muscle or in your back or in your neck or in your shoulder or in your elbow or in your hand, because pain is basically a kind of a signal which your body gives to you that there is something which is not right, and you have to listen to your body so that the symptoms or the condition shouldn't flare up. Because if it flares up, then it is going to take more time to recover. That will affect your productivity, that will affect your tranquility and quality of life. And at the end of the day, you'll be ending up paying more money for the treatment, and you'll be losing your precious time also. So listen to your body, that what the take home message is. If you have a pain, don't wait, reach for good physiotherapist, book your appointment at any of the clinic, and start getting better as soon as possible. With that, I would say health is always a wealth, and I hope you will not disagree with me on that point. You can see billionaires and billionaires. It's something which you can't buy over the counter. This is something which you have to inculcate. You have to live in a specific way to have a healthy life, right? So it's very important to be healthy, to be pain-free, and to have a good quality of life. With that, I would be concluding, and I can promise you we'll keep coming again and again on such platforms like Insta Live to put more light on these issues which are common and being faced by everybody in their routine life. With that, I must say thank you so much for all of you who have participated and asked such nice, interesting questions, and we'll look forward again to come back with new exciting topics. Thank you so much. Thanks.